Mental health reform embarked on the development of this cultural competency toolkit in recognition of the significant barriers and challenges that the ethnic minority community face when accessing mental health supports and services. The toolkit is aimed at mental health practitioners, anyone who is involved in the delivery of mental health services and supports, and it offers practical guidance on how individuals can ensure that the services that they're delivering recognise and are meeting the needs of ethnic minority community members. This toolkit is a project that's funded by the Sláintecare Integration Fund and the HSE, and in the delivery of this project we partnered up with the Cabra Community Mental Health Team who've been invaluable to the project.
The Cabra Community Mental Health Team were the pilot group for the development of the training programme to try and improve the service for people from ethnic minority groups, because it's been found that services aren't necessarily developed in a way that meets their individual needs, and a lot of barriers have been identified for people, such as communication barriers. People use different words and languages to explain their psychological well-being and any difficulties they can have. We're aware that a lot of forced migrants have a history of trauma, and we often have to work with interpreters, which can be challenging for service users and for staff members as well. After the training programme, an independent evaluator spoke to each person who took part to get some feedback on what was beneficial about it, and that programme is now being put together and a toolkit has been developed that's going to be distributed to mental health teams around the country.
Research shows that the ethnic minority communities face significant barriers when they try and access mental health supports and services.
Individuals coming into this country, they may not be aware of GP services, hospital services, community mental health team services. So ideally, I think we should be reaching out so that we can tell them about what we do and how we may be able to help.
The first time I experienced mental health difficulties was in 2017-2018. My friends brought me to a doctor and I got referred to one of the mental health services. My English wasn't that good at that time, so they had to give me all the information about my diagnosis on a piece of paper in my own language, in Arabic, and that was a bit shock for me when I read it. It's not like when someone just say it gradually, so it was a bit hard. The first time I got discharged from hospital, I didn't access any mental health support because I didn't know about the services you have. So I worked with my counselor in Syria through the phone. Definitely, I think it's gonna be more positive if I had an interpretation services, because that will make things more easier for me to accept it.
I think mental health service in Ireland need translator people in the service because it's huge problem with barrier of culture, barrier of languages. We need also mental health advocacy who be between patients, doctors and nurses. We need more free services for people as therapy, yoga classes, art classes, any courses which make people active. Plenty of people are alone in Ireland. They have no family, no friends, which is very difficult when you have mental health difficulties. So we need contact with other people.
The feedback from members who took part in the project was really, really positive. They found it very relevant and found the toolkit very practical and helpful, and gave them some space to really think about their own attitudes and how we can learn together and figure out how best we can support people in a culturally sensitive manner.